Hello and welcome to the Pain Pod. My name is Dr. Joshua Wellington, and today I'm joined by one of my wonderful patients, Julianne. We're going to talk a little bit about an unusual treatment for a condition that she's been dealing with. The treatment has been around for quite some time, but the application of it towards what she's been dealing with is something a little bit novel. And so this is some information that we wanted to get out there because it certainly might help a lot of people. And so Julianne, thank you very much for joining me today.
Oh, thank you for having me.
So, what I'd like to do is perhaps just allow Julianne to talk a little bit about what brought her to me. It was, I think, a couple of years ago at this point that your primary care physician had referred you because you were having some real challenge dealing with anxiety, with panic attack, with agoraphobia or fear of going out into open spaces that was crippling your lifestyle, if we
Yes.
may say. So I'll let you kind of take it from here with a description, maybe a little bit of history of what brought us together.
Okay. It was actually 2 years ago this month that I first started seeing you. I have complex PTSD. I was raised by two crazy alcoholic parents and suffered systemic trauma and abuse growing up. And while I learned how to function, more or less, I was dealing with an eating disorder and panic attacks and agoraphobia. I pretty much was housebound
Hmm.
and had stopped doing things for myself. I had been married for 18 years. As a classic trauma survivor, I ended up with an abusive person in my life. And
Yeah.
after I divorced him, everything seemed to crumble. And while I had been functional, so to speak,
Surviving,
surviving
basically.
basically,
Yeah.
yeah, that's a good way to put it.
Hmm.
Once I was out of that marriage, things just started spiraling down for me.
How long ago was that?
I was divorced in 2011,
Okay.
and in 2014, I was living in a 29-foot travel trailer in Arkansas, and completely isolated.
Hmm.
And I had a conversation with my mother and realized that my mother is now 87 and she has some memory issues. And I moved in with my mom and stepdad to slowly begin transitioning into being a caregiver, and I just kept isolating.
Hmm.
And then my stepdad was diagnosed with stage 4 throat cancer in 2021
Okay.
after the COVID lockdown.
Mm.
I loved the COVID lockdown. For somebody like me, it was perfect. I didn't have to go anywhere. I didn't have to do anything. I didn't have to talk to anybody. I didn't have to go to the grocery store. I could pick up groceries in the parking lot of the grocery. It was perfect for somebody like me, right?
Right.
And then I had to go to the VA hospital with him every day. He went through 35 radiation treatments and 7 chemotherapy treatments. And I wasn't coping.
Yeah. What was that like to be forced out at that
It,
point?
it was horrible,
Hmm.
you know? And I did it. And I have an online community that I belong to, and it's an online community of trauma survivors. And somebody there was telling me about the stellate
Stellate ganglion
ganglion block.
blocks. Hmm.
And I did some online Google research about it and thought I could do that, maybe. It sounded scary, right?
Well, it does. For those who don't know, a stellate ganglion block is literally putting a needle through the neck under X-ray guidance to block what is called the stellate ganglion. A ganglion is a collection of nerves, and this is part of the sympathetic chain, which is part of our anatomy that is kind of that fight or flight response. And so the sympathetic chain has a number of ganglia, and all the way down to our tailbone at the ganglion impar, coming up through the lumbar region with the lumbar sympathetic plexus, through the thoracic sympathetics, all the way up into the neck where we have a stellate ganglion, and then another ganglion one step higher at the back of the nose called the sphenopalatine ganglion. But you had done your research on the stellate ganglion because there's actually a pretty good data research that has shown that blocking the stellate ganglion can be an effective technique for the treatment of PTSD, which has been used a lot in soldiers returning from wars. And so that's been a treatment that's been a little bit more known now just because of our many soldiers who have returned with trauma and have undergone stellate ganglion blocks with improvement in their symptoms. And so was that some of the information that you had found?
You actually gave me more information there than I had learned. But there was a woman in my online community who's had that done.
Okay.
And she highly recommended it. And I talked to my primary care physician about it. And she said, I know nothing about it. Let me put you in touch with somebody who probably would.
Mm-hmm.
And that's how I ended up coming to see you. And it's interesting because I have complex PTSD. And then there's regular PTSD, if it can be called regular. And you get regular PTSD from single event occurrences, right? Like being in a car accident or going to war or whatever. Complex PTSD comes about when you've experienced traumatic events day after day after day after day after day.
Mm-hmm.
And a lot of the treatment that's out there right now is for single event PTSD.
Mm-hmm.
And there's not a lot of treatment out there for the complex PTSD. It's getting better, but I'm 63 years old,
Yeah.
right?
Mm-hmm.
When I was first trying to find treatment back in the 70s and the 80s and the 90s, there was none. And so for my anxiety, it was, let's medicate you,
Yeah.
right? And
Yeah.
so I ended up over-medicated.
What sort of medications were prescribed?
Well, I was diagnosed with everything from borderline personality disorder to bipolar disorder to dissociative identity disorder, and nobody talked about PTSD.
Yeah, or the complex,
Right,
string of events over the course of your development
right.
that brought you to that point, that repeated trauma.
And that repeated trauma over and over again led to people talk about having anxiety attacks. I remember when the first big box stores were opening, right? And I remember going into my first big box store and getting stuck in the back of the store for 2 hours because I couldn't get out, right? And what I did is I curled up on one of the bottom shelves and hid because I couldn't figure out how to get out of the store. And people don't talk about the
Wow.
debilitating aspect
Yeah.
of overwhelming panic. And I lived with that for day in and day out and learned how to function even at that high level of panic and anxiety. Benzodiazepines were prescribed, muscle relaxers were prescribed, a whole shelf full of psychiatric medications were prescribed, and nothing helped. Nothing helped. Okay. So I did go through some very good cognitive behavioral therapy designed specifically for people with trauma. And it was in the middle of that I came to see you the first time.
Okay.
So doing the trauma therapy helped kind of get me out the door a little bit.
Right.
But what you've done for me has changed my life fundamentally in a way that I'm not sure I can fully articulate. I will try, but I'm not sure I can fully articulate it.
Well, from the time that we met 2 years ago, the description that you are giving, you were basically, a little over 10 years ago, bound to a trailer until you moved to help with your mom and stepdad. And at that point, though, even still, you were incredibly limited with being able to get out, and the pandemic was a gift because you were mandated to stay
I
inside. But
love the
then
pandemic.
the research that you did on your own, because you recognized that that's not a way to live life
Right.
and you wanted a better life, of course, led you to finding about stellate ganglion blocks. And as I'd kind of described a little bit earlier, the sympathetic chain, that fight or flight response that our body has, I had done some reading. There had been an article in a journal that I had read just describing the use of sphenopalatine ganglion blocks for the treatment of post-dural puncture headaches, or in plain English, a spinal headache, which can sometimes happen after a spinal puncture. For women who are having a baby and get a spinal, that can sometimes result in a headache. Well, rather than taking blood out of the person and injecting it into the epidural space of the spine, it's been found in research that by blocking the sphenopalatine ganglion, just by literally dripping lidocaine through the nose when a person is lying down, that can also have efficacy. So it got my wheels turning, thinking, well, if we can block the sphenopalatine ganglion so easily without any needles through the neck, through the face, through the nose, this might be a treatment option for people, not only for spinal headaches, but maybe for other things. And then I was tying the two together with the research on stellate ganglion blocks for the treatment of PTSD. And I thought, well, what if we just go one ganglia higher to the sphenopalatine ganglion? And that's where our conversation started when we met 2 years ago. I said, Julianne, I would be more than happy to stick a needle in your neck, but maybe we don't have to. Maybe we can just try dripping some lidocaine in the nose. Very easy. You just lay down flat, put your head over a pillow, tilt your head back, and I just drip some lidocaine in the nose. Do that a couple of times, about 10 or 15 minutes apart. And what was the first result?
Shocking, actually. It was shocking. So
Like, what
it,
did you experience?
it's hard to explain because it was, I remember getting glasses when I was 11 years old. It was the first time that they put me in glasses. And I remember when my mom drove me home going, there are leaves on the trees.
Yeah.
I knew there were leaves on the trees, right? That wasn't a surprise.
Mm-hmm.
It was seeing them so clearly from a moving vehicle
For the first
for
time.
the first time.
Yeah.
Getting the treatment from you the first time was like going, there are colors in the world, right? It's like I'm seeing things that I knew were there. I'm just seeing them differently. I have extreme insomnia. I have insomnia so bad, I've done absolutely everything for my insomnia. I could sleep after this treatment.
Wow.
Yeah, wow is not strong enough.
Big wow.
I was existing on like 4 hours of sleep a night. And I think the first night after the treatment, I got 6.
Mm-hmm.
And my body didn't know what to do with that.
Yeah.
I can actually now tell when it's getting time for my next treatment because I wanted to go back and look at my calendar to see how long it had been between the first one and the second one. I actually think it was like 4 or 6 months.
Wow.
And then when I showed up for the second treatment, it was like, no, we have to do this more frequently.
Mm-hmm.
And then we went to every 3 months. And then stuff happened this summer that I'm sure we'll talk about. And I got to the point where it was like, nope, I'm losing the ability to sleep at about week 10 and a half. And so
Mm-hmm.
we agreed to go to 11 weeks.
Right.
And so we've now been doing this every 11 weeks, and it's awesome.
So what do you experience in terms of the anxiety, the panic in open spaces that you used to experience that limited you? Well, what is it like now?
I've talked about my online community. So at the beginning of COVID, I started an online community as a way to find some kind of connection with other human beings for myself.
Yeah.
Okay.
Yeah.
We had a meeting this morning. There are about 600 people in the community now.
Wow.
And yeah, I'm not even going to talk about what that is.
Okay.
But trust me when I say that doing this has helped with
It's a
that.
big community.
It's a big community. It's a 12-step based community, which is why I'm not talking about what it is
Mm-hmm.
specifically. And I asked people who've known me for 3 years, okay, to judge how I have changed since I started getting this procedure done. And the overwhelming response was that I am less reactive, I'm more patient, I'm more willing to listen to people, I'm more capable of. One of the trauma responses that people have is the need to stay busy. Okay? We don't know how to be quiet. We don't know how to be calm. And one of the things that they've noticed about me is that I'm delegating better, right?
Right.
I don't feel like I have to do absolutely everything myself. So that's just within my community.
Yeah. What
With
about getting outside a
Yeah,
little
with my
more?
personal life. Yeah, you're waiting for me to talk about
I
this.
can't
I know
wait.
that.
I'm so excited for you.
I had not traveled in 6 years. Okay. I have lots of tattoos, and I tried to get down to New Orleans, which is where I was living at one point and where I started getting tattoo work done. And for 6 years, I couldn't. I couldn't leave the house to go down and get tattoo work finished. Let's see. So I started seeing you in December of 2021. In the middle of 2022, I said, as soon as COVID is over, I'm going to travel. I've always wanted to travel. I had a passport that I'd never used. And as soon as COVID opened up, and as soon as we felt like my stepdad was stable enough that if I brought anything home,
Yeah.
germ-wise, that he would be okay,
Right.
I planned a 3-week vacation. Oh, and I started going on websites for dating also. That was I did that first. Okay, so sex was not a thing for me. Being physically intimate was not a thing for me. Being emotionally intimate was not a thing for me. And in April of this year, I went on a website and started being willing to date. I've not run away.
Yes.
I've not withdrawn. I've not succumbed to fear and anxiety and panic about it. I've been able to say, crap happens,
Right.
and let's try again.
Yeah, you're getting yourself out there. Out is the key.
Out is the key.
Right.
Actually meeting somebody in person
Remarkable.
at a neutral place, right?
Yeah, right.
We don't need to talk about online dating safety.
Of course.
Yeah, don't have them come to your house the first time.
No. But getting out and in a
But
public
getting
place.
out in public place,
Wow.
that was huge for me.
Yeah.
And doing it without panic attacks, it just is remarkable for me. So I planned this vacation, this 3-week vacation. I don't do things by halves, right? I'm
Yeah.
either all in or all out.
There you go.
And I got in my car and I drove to Washington, D.C. And I spent 4 days in Washington, D.C. And I did all this on my own. Okay. So I did 4 days in Washington, D.C. I did every place I've ever wanted to go to, the Smithsonian and the White House and the Lincoln Memorial. And I was on the mall and I walked so many places and I figured out how to get from my hotel to Washington, D.C. And I had to use public transportation because I wasn't
Wow.
going to drive on my own. And then I went to Baltimore and stayed with a friend that I met in my online community and went all over Baltimore. And then I drove to Pennsylvania. And there are these places called dark sky parks.
Yes.
Where you can see the night sky without light pollution.
Right.
And I camped out. I took all my camping equipment with me because I hadn't camped in years.
Yeah.
And I camped out at this dark sky park, and unfortunately it rained that night, and that's okay. And then, because I camped in the rain, and again, didn't panic.
Big open space.
Big open space, out in the open.
Yeah.
And I had the option of sleeping in my SUV if I couldn't, because I took that, held that option too. I
Yeah.
slept in the tent.
All right.
It was like, It's good. And
Yes.
then I drove to Toronto, Canada. So I
Wow.
crossed over into Canada
Oh my gosh.
on my own. And yeah, gosh. And I drove in Canada on my own. And the first place that I stopped in Canada was Starbucks because I kind of freaked out a little bit about money. And I had a Starbucks card. And so I figured I'd be able to use my Starbucks card in Canada, and I could.
Wonderful.
And I stayed with a friend in Toronto for 3 days. Again, figured out public transportation, walked all over Toronto. And things happened that in the past would have stumped me or tripped me or baffled me, right? I mean, I have GPS, and my GPS took me the wrong direction when I was coming into Toronto, and I had to circle almost all the way around the city to get back. And I was able to go, okay, I'm not going to die because I missed my exit.
Yeah.
Whereas
Right.
in the past, it would have been a catastrophe, and the panic would have been there.
Right.
You know, when I was leaving Toronto, I drove to Montreal. Coming out of Toronto, there were 17 lanes of traffic. I know because I counted,
Wow.
right? And I thought, I've never driven on an interstate this large before, and I'm doing okay. And not only am I doing okay, I'm having a good time. And people don't think about how you pre-think things when you've got anxiety and panic.
Right.
I would only go to a very limited number of places, right? I would go to this grocery store and this grocery store only. I would go to this restaurant and this restaurant only. And if I had to meet somebody at someplace new, I would drive around a day before I went to meet them because I needed to know where the parking was and where the entrance to the parking lot was and where the entrance to the building was, because these things panicked me.
Right. So much effort.
So much effort. And so on this trip, I'm driving from Toronto to Montreal, and I'm going, I'm going to stop and get gas at a place where they're going to measure it in liters, not gallons. And they're not going to speak English because I'm now in the French-speaking part of Montreal. And you know what? I'm going to be okay. And I made it work.
Yeah.
I went from Montreal, and I stayed at a hostel outside of Montreal, which was
Really?
an old nunnery. It was really interesting. And that went fine. And I drove through Maine, and I stayed with a friend in Maine. And I went hiking in Bangor State Park, which was a lot of fun. And then I drove to Acadia National Park, and I spent the night in Acadia. And so I'm out camping again. And I actually got to
Wow.
have my dark sky experience in
good.
Acadia. It was gorgeous.
It's a beautiful place.
1:30 in the
Wonderful park.
morning, I'm out walking the park by myself,
Wow.
looking at this gorgeous sky.
And would that have ever happened
It
10
would
years
never
ago?
have happened
Right.
before. And so then I went to Boston, and then I went to Cleveland, Ohio, and then I came home. Trip went well.
Amazing trip.
I'm home a week. Well, no, let me back up. I couldn't hike the way I used to because I have an injury to my knee now. And so I saw all these vehicles driving by with kayaks on them. And I thought, I wonder if I could do that. I'd never kayaked before. I canoed when I was younger. And so I came back to Indianapolis. I found a kayak rental place. I went and rented a kayak for 30 minutes, fell in love, and went and bought a kayak
It's great.
and learned how to put it up on top of my SUV and take it down all by myself. So I took the kayak out once or twice or whatever, and I've been home a week from my 3-week vacation, and a friend calls and says, I'm in North Carolina. I rented a cabin for my husband and myself and another one for my aunt and uncle, and my aunt and uncle can't come. Would Julianne like to come to North Carolina for a week? Yes. So I was in the car within 12 hours, completely packed, spur of the moment, drove to North Carolina, and went whitewater kayaking. That
Remarkable.
would never have happened. So I've got a kayak. I've been whitewater rafting, whitewater kayaking, I take the kayak, well, before it got cold, I was taking the kayak out 3 days a week,
Mm-hmm.
and I'm dating somebody. Yeah, my life has changed fundamentally.
I would say so.
And all I do is you drip lidocaine up my nose every 3 months.
Kind of amazing. Kind of amazing. And I just am so thrilled that you have your life back with something so simple that I can do, but so novel as well. Because to my knowledge, this treatment isn't being used for this sort of condition. And to think that we can successfully treat panic and anxiety and PTSD that's complex even successfully. And I'm sure it doesn't work for everybody, but nothing works for everybody. But if it can work for some people and like it's worked for you, how amazing that is.
What I have found is the more consistently I get the treatment, the less the anxiety response I have is. It's like it's cumulative,
Yeah,
right? It builds up.
yeah,
Yeah. And the way I explain it, and I don't know if this is accurate or not, and I don't care, it's the way I explain it. It's like the anxiety response gets short circuited.
hmm,
And so over time, my body is being retrained
yeah.
to not panic, whereas before, all I knew how to do was panic.
Yeah, I think by blocking that sphenopalatine ganglion, which is part of our fight or flight response, we're interrupting those signals that is actually letting your brain start to reprocess things in a more normal way so that you don't go immediately into panic mode, fight or flight. You are able to just breathe. You're able to exist. You're able to go outside. You're able to go on trips, camp, date, things that would have never been possible, you know, even 5 years ago.
I wouldn't even have thought of them.
It just truly life changing. And that's why I wanted to bring you here today so that we could talk about this. I mean, just that you're able to come out and do a podcast is remarkable to me. And because I don't think that would have really happened prior to 2 years ago when we first met.
Yeah, no.
So I really appreciate you sharing your story with me, with all of you who are viewing today. I know that this is a pain pod. You know, I'm a pain medicine physician, but I think that this is remarkable enough that I really wanted to get this information out there so that hopefully more lives can be changed like yours, Julianne.
Well, thank you.
Thank you very much.